So this is the organ prep table. This is where they prep the organ. It has its own tray. It's counted separately. Usually you have 18-inch ties, 2.0 and 3.0. I have extra on the back table over there. It's not as pretty because I was kind of in a hurry. This is the main setup. I put all my drapes here, gowns in the other basin. And then onto the table, you have clips, the aortic punch. I have a 10 blade and 11 blade loaded on the long 7. Clips, I think I said that. On the left is normal saline with ice to squirt their hand. On the right is heparinized saline. I have a 5.0 and 6.0 on casters, always ready to go. Laps and Raytex in the back. I have white towels in that tray, which I sometimes try to hide until later during the case. We only use 3 trays at this facility. We use a kidney tray and then part 1 and 2 of the book Walter. As you can see, my boots are loaded on mosquitoes, always mosquitoes. This tray is very convenient, it's very minimal, and this is all that we ever use normally during a kidney transplant, a very basic setup, which I'm grateful for. I put all my retractors in the back over here. We don't use a lot of retractors to dissect down, maybe a Bolt, maybe a Richardson, very minimal, and I have all my forceps loaded on the side. And then, of course, we always have our clamps, which are over here. At this facility, the doctors either use we use the Satinsky for the vein clamp, and then we use the Fogarty clamps for the artery. And then we always have our trusted book Walter. We have 1 and 2 parts at this hospital. And, of course, you try to just organize it the best way you can. This system worked for me. Everyone has their own system. And then over here is my Mayo. This is just my Mayo to dissect down. I have ties, which I'll put underneath my towel later. Bovie, suction, some laps, short debakey, fat debakey, a right angle, and Met scissors. That's all we use to dissect down until we put the book Walter, and then, of course, fluid warmer for when we're done.